In this video, we're going to look at stretches for plantar fasciitis, but I'm first going to look at what the research shows. Does stretching actually work? Also, what areas of the body should you be stretching? And how researchers think stretching helps plantar fasciitis. Then I'll answer some common questions people have about plantar fasciitis and stretching. And finally, I'll demonstrate all the different stretches for you. I'll also tell you about an app that you can use to guide your rehab for plantar fasciitis. And there's a discount code that you can find in the description of this video. Now, I've added chapters to this video because it is going to be a long one. So have a look at the description if you want to jump to the relevant sections for you. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. So, what does the research show? Does stretching actually benefit plantar fasciitis? Yes, there's strong evidence that if you include stretches for your plantar fascia, it can reduce your pain when you've got plantar fasciitis. There's also evidence that points to perhaps if you include stretches for all the muscles in the posterior chain, which is the glutes, the hamstrings, and the calf muscles, that you may even get better results. Now, why are these called the posterior chain? It just refers to the fact that the glutes are connected to the hamstrings, connected to the calf, connected to the plantar fascia via thick layers of fascia, which is like sinewy tissue. And also the Achilles tendon attaches or runs down to the heel and attaches the calf muscle into the plantar fascia via another layer of fascia. How does stretching help with plantar fasciitis? We're not actually sure yet. There aren't any studies that specifically looked at this question. But there are a few theories. Now, the first theory is that if you can reduce the tension in the posterior chain, so all those muscles that connect to each other, there's less pull on the plantar fascia and that will cause less irritation. But we also know that stretching can reduce the activity in the sensors you've got that tells your brain about the stretch and pressure in your muscles and your tendons. So it's useful to think about why do we feel pain. Whenever we've got an injury like plantar fasciitis or any other type, the sensors in that area that tells the brain about pressure, chemicals, stretch, all of those type of things becomes hypersensitive and sends more messages to less stimulus to the brain. And that causes an increase in your pain. The idea here is that it protects you. But we know that when you've had an injury for a long time, those sensors can become overactive and send too many messages, and that causes extra pain on top of what you should be feeling. Now, when we do long sustained stretches, so 30 seconds or slightly longer, it calms those sensors down, especially the ones that tell the brain about stretch and compression. So we think that stretching may also help because it reduces that overactivity of the sensors, and that reduces the pain. But that's also why stretching, the pain dulling effects of stretching is short-lived, and you've got to repeat these stretches quite often, usually every day, if you want to keep the pain at a good level. And that's why stretching is only one part of your treatment plan. You have to include other things like strengthening exercises and the right shoes and orthotics to help your plantar fascia recover fully. If you want to know more about those, I've made videos about all the treatment options as well as specific strengthening exercises, and that's all included in the description of this video. Then the last theory is also that if we think of the posterior chain again, it's not just the sensors in the area of the foot that become sensitized. We know from studies that the longer you have pain for, the more of these little sensors become sensitized in areas closer and further away from this injury. So it may also be that the sensors in the muscles in the posterior chain becomes overactive and becomes creates more pain for you. And that's why stretching the other muscles in the leg can help reduce your pain. Now, which one of these theories do I think is the most plausible? I think the one with regards to the sensors being overactive, because we've seen that apply to lots of other injuries as well. But to be honest, I think it's likely a combination of them all. The key here is to understand that stretching is not an amazing thing that will fix everything, but it's a very useful part of your treatment plan. Okay, so let's look at a few common questions I get asked about plantar fasciitis that kind of relate to stretching. The first is, can plantar fasciitis cause leg pain? Now, it doesn't directly cause it, but if you've had pain for a while and it's affecting how you walk, then because you're now not walking like normal, that can cause other parts of the leg to become painful. Also, it can cause the muscles and everything that's close to it to become a little bit tighter and uncomfortable and get trigger points. And in that way, it can cause leg pain. However, if you feel that your pain has started in your calf or your thigh and then moved to your foot, it's likely that the pain you feel in your foot is not plantar fasciitis, even though it feels in the same place, but that it's referred pain from higher up. So if that's the case, have a check by a physio because they'll be able to diagnose it for you. Another question is, can tight calves cause plantar fasciitis? It doesn't look like it. A recent review of all the literature on plantar fasciitis and the risk factors for that came to the conclusion that tight calves are not a risk factor for plantar fasciitis. It's more often or more likely caused by overload, and you can find more information about that in the previous videos I've made about plantar fasciitis. But there is evidence that people who's had plantar fasciitis for a long time tend to also have tight calves. So although tight calves doesn't cause plantar fasciitis, having plantar fasciitis for a long time causes tight calves. So that's why stretching is a useful part of your treatment regime, but it's likely just not going to prevent you from getting plantar fasciitis in the future. It's more important what you do activity-wise and what shoes you wear. Then people often also want to know whether tight glutes can cause plantar fasciitis or foot pain. Now, no, it can't cause plantar fasciitis. It can irritate it if you've already got plantar fasciitis, because the theory of it causing a pull in your posterior chain, but it can cause foot pain. And the reason for this is your sciatic nerve runs through your glutes. So if your glutes are really tight, they can hold onto the sciatic nerve and not allow it to slide freely. So whenever you put your leg forwards and backwards, your nerve has to slide. Nerves don't really like being stretched. Now, if the glutes are holding onto it, the nerve gets stretched instead of sliding, and that can cause it to become irritated. And that then can cause pain around the heel as well as under the foot. So if you're finding that your glutes feel really tight and you sometimes get foot pain with that, have a check by a physio, because it may very well be that your foot pain is not plantar fasciitis. It's actually to do with the glutes. And if you sort that out, then your plantar fascia or the foot pain will decrease as well. Let's have a look at some general guidelines that you've got to keep in mind when you're doing these stretches. Otherwise, you may actually make your injury feel worse. Now, the first is that none of these stretches should cause you pain while you're doing it. And it should also not cause an increase in your pain after you've done it. And that's important because often stretching doesn't cause pain in the moment, but then several hours later, you may feel, oh, my foot is so much more painful. I wonder what I did. And it's actually the stretching that caused it, or other exercises or an activity that you caused it. So there's often a delayed pain response. So make sure that you check if you're doing stretches, how do you feel later in that day and the next morning afterwards? Then you're not meant to stretch as hard as you can. Remember, we're looking to calm the overactive sensors down. And the best way to do that is low level stretching, where you take it to where you can feel a resistance, but it's not painful and it's not really, really strong. And you sustain it there for about 30 seconds at a time before you rest and repeat that again. Then, importantly, these exercises may not be right for you. There are several different ways that you can stretch the plantar fascia as well as the other muscles. And depending on other injuries you may have, or just the way that your body moves, the ones that I demonstrate may not be appropriate. So it's best to check with a physio before you try any of these. I'm going to demonstrate 2 plantar fascia stretches for you, because depending on how sensitive yours is or the shape of your foot, you may not be happy with one, but the other one works best. So test the easy one first, and then later on move to the other one if you like, but you don't need to do both of them. Choose the one that works for you, because that will be enough. Let's start with the gentle plantar fasciitis stretch first. Now, this one's really useful first thing in the morning before you start to walk, to help decrease the discomfort you feel first thing in the morning. Because if you've had plantar fasciitis for a while, you'll know that those first few steps are the most uncomfortable and painful. And the reason for that is when you're lying still at night, that injured area has less circulation because you're just not moving. So there's more chemicals that's being caused by the chemicals that's being caused by the injury accumulates, and they irritate the nerve endings, so that causes more pain. And also fluid accumulates in there, so it feels a lot stiffer. Then that's why when you start to walk, it's like, oh, that feels uncomfortable. But then as you give a few steps, it suddenly feels slightly easier. And that's because your circulation improves, gets rid of the extra fluid and the extra chemicals, and then it eases off. So this stretch can be useful, and you can even combine it with massage. And I've demonstrated massage techniques in a different video, so have a look at the description of this video. So what you do is you just sit, and you can have your foot either in front of you on the bed, or you can just have it in whatever position is comfortable for you. And if we think of the plantar fascia, oh, sorry, my foot's not that clean. It runs from your heel to the front of the foot. So if we bend this back and we pull the toes back, we can really stretch it. Now, it also stretches more because when you bend your foot back, because it attaches via the Achilles tendon to the calf muscle. I would also always start, if you're new to this stretch, just feel what it feels like if you just bend the front of the foot back. How does that affect your foot? If that feels pretty okay, you can then also gently bend your toes back, because that increases the stretch. But always start with whatever is the most comfortable for you. Then again, if you've got a very sensitive foot, I would keep it for about 10 seconds only, release it, move a bit, and then perhaps repeat it. If you're holding it for 10 seconds, you can repeat it 3 to 6 times. If you're holding it for longer, if you're holding it for up to 30 seconds, then I would say only repeat it 3 times. Now, you could stretch it once and then do a bit of massage on it and just help it along that way, and then repeat the stretch. So the simplest one is just bending the ankle back. If you want to increase it, you bend the ankle back and pull the toes back as well. For the stronger plantar fascia stretch, you're going to need a wall. And you can do it in shoes, but you can also do it bare feet. I tend to not prescribe this one so often because it can often irritate people's big toes. So if you've got any issues with your toes, this stretch is not for you. I would rather do the other one. So what you want to do is, let's say that it's my right leg that I want to stretch, is you place your toes against the wall so that you're looking for them to bend up like that. Now, I have super flexible toes. That's why mine can bend like that. If you've got stiff toes, it will likely look something like that. It won't be able to go all the way like that. But then when you've got the toe to the point where you may just want to stand like that if you already feel a stretch under your foot. But if you don't really feel one, you can also bend your knee to increase that stretch and see if you can feel more. But like I say, it can sometimes irritate the big toe, so just check what is best for you. Start with short holds, about 10 seconds at a time. Come out, move everything. Repeat it 3 to 6 times if it's only 10 seconds. If you're holding it for half a minute, then I will only do 3 repetitions. Now, the research shows that if you do plantar fasciitis stretches more than once a day, it may actually be more beneficial. I would not do the strong one more than once a day. So I would possibly do the easy one first thing in the morning when everything is really stiff and then do this one later in the day, or just do the easy one twice a day. But you may also benefit from doing some massage rather with the ice bottle later in the day. So check out that video if you want more advice about that. The second most useful stretch after the plantar fascia stretches is the calf stretch, because the calves are usually the first muscles to become really tight when you've got plantar fasciitis. And for me, the simple stretch in standing is always the most effective. So what you want to do is you want something to hold on to, because this is not a balance exercise. You can even press against a wall. And the foot that you're going to stretch will be at the back. So that one's at the back. And you want to keep the knee straight and the heel on the floor. The other one is further forwards. Now, if you're really tight and stiff, don't give a big step. The bigger the step, the more the stretch. So we're looking for just what is comfortable for you. Now, you keep your heel flat. Your foot is pointing straight forwards. It's not pointing out to the side. So make sure it's straight forwards. And then if you're not feeling a stretch in the calf yet, you start bending your front knee. But I'm not doing that. I'm keeping that straight. I'm bending my front knee until I feel a gentle stretch in the calf. And then you hold that position for up to 30 seconds. And then you come out of it, relax a bit, possibly do the other side to just give this one a little bit of a break. And then you go back into it. So as you get used to the stretch, you can put your leg further back. But remember, there's always a limit to how far a joint or a muscle can stretch. And we don't need super flexibility. We just need it to not be overly tight. So if you're doing the stretch and you're feeling a lot of discomfort at the front of the joint, it means that you've reached the limit of what your joint can do, and you're now just pushing the bones together at the front. So at that point, stop pushing. Don't go into it and try to sway your body to one side or another side to get more range. That's not going to be helpful. It's about just getting enough relaxation in there for it to not be painful. Okay, so don't overstretch. Just use your common sense with how far you take it. Now, the calf stretch can be done daily if you feel you need it, but if your calves don't really feel that tight, you can just do it as and when, so maybe 2-3 times a week. For the glutes, I'm also going to show you 2 different options. One, if you're really stiff in the glutes, that you may want to start with, or if your knee is quite sore, that one's good as well. And the second is, if your knee is happy to twist, you're not too tight, then you can do the second one. I usually tell my patients to stretch their glutes before they stretch the hamstrings. And the reason for that is your sciatic nerve runs through your glutes. And if you can loosen your glutes off first, it slides more easily, and therefore your hamstrings will let go and you can get better range of motion there. Now, for the first one, you're just lying on your back. If you struggle to have your head nice and comfortably on the floor, like your chin's sticking out and you can't get your upper back flat, have a cushion under your head. Then, if we think of stretching the right leg, I'm going to cross my right leg over my other one. And you can bring it as far as you like. Then right hand goes on right knee, left hand goes on lower leg. And when we pull, we're going to pull it to the opposite shoulder. So I'm pulling my right leg to my left shoulder until I feel a stretch in my glute. So let me show you the other way around. Left leg comes over right thigh, left hand goes on left knee, hand goes on lower leg, and I'm pulling it now to my right shoulder. I'm pulling it up as well as slightly over. And I'm only taking it as far as I need to take it to feel a stretch here. Now you can hold it for 10 seconds, hold it for 30 seconds if it's not that tight, and bring it out, move a bit, do the other side, and that should be enough. Now, if you don't feel a real good stretch with that, something you could do is the figure 4, which instead of putting the leg across, you now just place the ankle just above the ankle on your thigh and you let your leg drop out. And then you grab hold of this thigh, so you're putting your hand through that gap and pull it up to your chest. So let me show you with the other leg. So I'm putting my ankle, so I'm not putting my foot on there because then it's going to squash my foot up and hurt my ankle. I'm putting my ankle just above my ankle on my thigh, putting my hands through there, pulling it up and holding it there. Now, you don't have to do these every day. It's usually enough to do them 2-3 times a week. And if you don't find that you're really tight, you don't have to do them at all. So it all depends on what's applicable for you. So check what you need and just do the ones that you need. For the hamstrings, I'm going to show you some adaptations from the typical hamstring stretch that you can do if you find that you're really tight. So let's have a look at the full stretch first, and then I'll show you what you can do if you go, that is not possible. So for the hamstring stretch, your hamstrings are back of the thigh, and you want your knee fully straight and the other one bent up. Now, you can have the other one drop out to the side if you're flexible enough, or it can actually just stick up there as well. But the key here is the first thing is to really make sure that you can have your knee straight. Then, second is you slide down your leg until you feel a gentle stretch in the back of your leg. And that's where you stop and you hold it. Now, if you're going to pull your foot back towards you while you're doing it, you're going to feel quite an intense stretch in your calf as well as your leg. And that's not actually your muscle stretching. That's your sciatic nerve that's stretching, because it also stretches in this position. So try to relax your foot, that you don't pull it back, and that you just gently stretch it like this. So I'm not going for my foot, I'm sliding down to where I feel the first stretch and just holding it there. Now, if you're laughing at this video going, I cannot sit on the floor even like that because I'm too stiff, find something to sit on. That can make a big difference. So if you can't get your knees straight, find a block or something to sit on. I've got a yoga block, but you can use cushions, you can use anything that puts your bum higher than your leg. You can even do this sitting in a chair, that you just lean forwards then. So then from this position, you first try to get your knees straight, knee is straight. Then see if you can gently start bending forwards and holding the stretch. And really the same counts for this as with the others. Start with short holds first. If they're 10-second holds, you want to repeat them about 6 times. If they're longer holds, like 30-second holds, then you only want to do 3 per side. It may also help if you actually stretch your glutes before you stretch your hamstrings, because the glutes can sometimes hold onto the sciatic nerve and make the stretch more difficult. So if you loosen them off first, it can actually improve your hamstring range of motion without you even trying. Now, you don't need to do these stretches daily. Usually doing them 2-3 times a week is enough. Some people find they don't even have to do them because their hamstrings aren't tight. Others find that they really benefit from it. So see what works best for you and adapt your program accordingly. Hope you found this all useful. And remember, if you need more help with an injury, you can also consult one of the team via video call. The link to the website is in the description of this video. Take care.